Well, the Southern Nevada Health District reports the first flu death for a child under the age of 4.
Coming up after the break, what parents need to hear and need to know when it comes to flu vaccines for your kids.
Southern Nevada has its first case of a child killed by the flu this season. The Southern Nevada Health District says the child was under the age of 4. The death comes as flu activity picks up across the valley. As of last week, 78 cases of the flu had been confirmed.
Joining us to talk about flu season and how children are affected and impacted is Dr. Robert Pretzlaff, Chief Physician at St. Rose Dominican Hospital. Good morning to you, Doctor.
Good morning.
Thank you so much for being here, Doctor. We hear of this with a young child. You've cared for a child before who suffered from the flu. Tell us what's happening with their body. What are they trying to fight off? Absolutely.
So right now my position is I'm the president of our medical group, so I'm very interested in keeping everybody immunized. But prior to that, I'm trained as a pediatric critical care doctor. So I've taken care of a lot of children with the flu in the ICU and quite a few that have died as well. The influenza is a viral infection, so it affects your entire body, but its most significant effects are on your lungs. So patients with influenza come in with high fever, chills, but also can have a severe pneumonia. And if you get a severe pneumonia from the influenza, it also can lead to secondary infections like a bacterial pneumonia, sepsis. And as I said, I've taken care of a number of patients, all children who have died from the flu.
You've seen it up close and the dangers of it. For the moms and dads listening, let's get into some nuts and bolts and details. If they had the flu shot last year, their child, are they still protected this year?
No, the flu changes every year. It's a kind of a unique virus in that respect, and so every year you need a new flu shot. You need to get the shot. Usually the beginning of the season is in October to November.
Okay.
The flu peaks in January to February and then it still hangs on until May. So it is not too late to get your flu shot now. It takes about 2 weeks for the immunization to take effect, but the flu season is just beginning.
And doctor, let's address the big, myths associated with getting the flu shot.
Right.
People think they're going to get the flu after getting it. Some people think that way.
You can't get the flu from the flu shot. The flu shot, there are a couple of different flu shots out there. They are either inactivated or just bits and pieces of the flu. So there's no live virus in the flu shot. You can get a local reaction. You can sometimes get a small fever. But if you compare that to actually getting the flu, it's nothing.
Okay, so we're encouraging people to get this flu shot as soon as possible. You've talked about the dangers of it, but let's say someone doesn't. Let's say they forget and their child gets the flu. Let's help out that mom or dad. What do? Is it right to the ER?
Not necessarily. If the child is sick enough to go to the emergency room, go to the emergency room. If you've got a mild case of the flu, going to the emergency room, the physicians probably won't be able to do anything for you.
Sure.
It's a viral infection. It has to run its course. There are some antiviral agents that work against the flu, but normally you have to give them within the first 24 to 48 hours of getting symptoms. Most people don't come to medical attention until after that. So if you have a mild case of the flu and you go to the emergency room, the most likely thing you're going to do is give somebody else the flu. If you're severely ill, of course, go to the emergency room.
All right.
Understand. Good advice.
Young children, individuals 65 and older, and pregnant women are at most high at risk, correct?
Absolutely. Okay. So, and also those with any chronic disease.
Okay.
Chronic obstructive pulmonary disease, diabetes, congestive heart failure. Anybody with a chronic disease should get the flu shot. As you mentioned, pregnant women, young children under 5, and older individuals are at the greatest risk.
Thank you so much.
But we should all get it.
Yeah.
Great advice.
Thank you so much for
all
coming in. We appreciate that. We'll be back after the break.